Jamie, registered dietitian, and welcome back to my channel. So it's been a while actually. I've been a dietitian for 5 years. And the last time I filmed was like 5 years ago. So now I'm currently trying to get back into filming and stuff again, like day in my life. So yeah, come along with me to see what my day in the life of a dietitian is at a LTAC. So I recently just transitioned from working in an acute care hospital to a long-term acute care hospital. And the main differences is a long-term acute care hospital involves patients who are here for a long duration, usually between 3 to 4 weeks. A long-term acute care provides services with complicated medical issues, including ventilator weaning, wound care, IV therapy, managing tube feedings, and severe deconditioning after a prolonged hospital stay. Whereas acute care involves life-threatening conditions and immediate responses to treating those conditions. And the hospital stay is usually only 5 to 6 days. So it's quite different. Today I have a long list of patients to see because we have our meetings on Wednesday and Thursdays where we talk about the patient. So on Mondays, I usually have a long list where I have to see everybody in-house. And today I have 22 patients that I have to see and write follow-up notes or do an assessment on. I have one new admission, which usually we have to see the new admission within 72 hours of them being admitted. So I do have to see that patient. And then I have 11 tube feeds and 7 malnutritions. So quite busy today. I will follow up with you soon. Okay, so I'm just back from seeing my patients in the ICU. So I saw 4 patients so far. 3 of them are on tube feeds and 1 of them, the diet just advanced to pureed diet, but they are vented in with the trach. So we're kind of pending tolerance to see how well they're gonna eat. And yeah, so now it's lunchtime. So I'll show you what I have for lunch. Okay, orange and chips. I have a wrap that I made, which is usually my go-to for lunch. It has veggies, protein, lots of fiber, so. And then I'm pairing it with this spinach artichoke sauce, like dipping sauce, so should be good. I am starving. I'm gonna go clock out and have lunch. Okay, so today was like such a busy day today after lunch. I had to go back to the ICU to finish up my patients that I had. And basically, I followed up on 4 patients this morning. And then I had 6 more patients to follow up on. And they're all on tube feedings because they're all ventilated with tracheostomies. Which ventilation is basically they're breathing through the ventilator. They're not able to treatment today on this one patient. So we'll see what happens. Hopefully we can get this patient off TPN, because we really don't like to keep patients on TPN long term. It's a high risk for infection, and it's really hard on the liver to be on TPN for long term. But the patient didn't have any like refeeding or hyperglycemia or anything, so the patient's doing really well on the TPN. And yeah, the other patients, I had one patient that has finally been able to come off of his tube feeds for a little bit because he's working with PT. So while he's working with PT, he's able to come off the tube feeds to have a little break from them. And he's been in the long-term acute hospital for over 2 months. He's had a long journey. He came in with he has a renal transplant. He's had multiple he has coronary artery disease, multiple cabbages, and finally he's conditioned enough to work with PT now. So he's doing a lot better, which I'm so glad. Hopefully he'll get to go to rehab soon, because he's just had such a prolonged hospital stay. But yeah, I saw him today and he seemed in good spirits. So but yeah, after that I went over to the med surg floor, and I had to follow up on a patient over there, change their water flushes, because this patient was not getting enough free water, and free water is very important for hydration while the patient's on tube feeds and stuff. So I had to change that, and then do a follow-up on a patient who hasn't been eating much. So I just ordered supplements. However, the patient has Parkinson's disease, non-compliant to medications, hasn't been eating. Other than that, that was pretty much my afternoon. And yeah, so now I'm headed to the gym, and I'm gonna do some cardio today, a HIIT workout, because I haven't been doing much cardio lately. I've just been doing weight training. So I'm gonna do that today and then head home. This is not butter, it's actually leftovers. Just use this container.